Diabetes Lesson 3.4. I will quickly go through some main points, however, anything on your PowerPoint can be in quiz. Okay, so these are the lesson objectives that we need to know. Before I get into diabetes, different types, I want to talk about what happens when we eat our food. Anytime we eat carbohydrates, it breaks down into glucose. That glucose enters into our bloodstream after it's digested. Then that means our blood glucose levels go up every time we eat. How do they go back down? They need insulin. Insulin is the hormone that's produced by the beta cells in your pancreas. Your brain tells the pancreas to deliver more insulin into your blood every time we eat carbs. That hormone, insulin, will act as a key, and it will allow glucose from your blood to move into the cells. Without that insulin, the glucose will build up higher levels in the blood and won't be able to be used by the cells or enter the cells. The cells will be pretty hungry. They need that energy. Okay, so when normally we eat, insulin allows the glucose to move from the blood into the cell, so that after a meal, blood glucose levels will go back down because they're going into the cells. Because of insulin, the key, and your cells will be happy. You'll have energy. As you can see, our blood glucose levels are pretty low or stable, below 126. Till we eat, it goes up. Insulin also goes up to help regulate blood glucose levels. Okay, once that glucose is entering into the cells, it goes back down, lower in the blood now, and higher in the cells. So diabetes type 1, only 1 out of 10 diabetics have type 1 diabetes, only 10%. The reason for it is genetic. There's no way to prevent it. The immune system basically attacks and destroys the beta cells of the pancreas so that it no longer produces any insulin. That means diabetic type 1 patients need to get insulin injections or medication every day for the rest of their lives in order to get that glucose from the blood into the cells for energy. They have to make sure to take their medication and time it with their meals, have set meals, and exercise as well. Type 2 diabetes. 9 out of every 10 diabetic is type 2 diabetic, the majority. This is caused by lifestyle behaviors, eating too many calories, specifically carbohydrates, not working out enough to burn off the extra glucose energy. This happens over time, so usually it is not diagnosed in childhood like type 1. It's diagnosed in adulthood. Okay, usually people become overweight from eating too many carbohydrates, and then they develop higher risk, especially if their waistline is bigger than the limit. They'll have a higher risk for diabetes or CVD. And unlike diabetic type 1 patients, type 2 patients, their pancreas does produce insulin. However, it's either not enough or it's not being used by the cells properly, so the glucose is just hanging out in the blood. Those blood glucose levels will rise. It's not entering into the cell as efficiently as someone without diabetes. So what happens? Either, like we said, in the first picture you see some damage to the receptors for insulin, so that insulin can no longer act as a key to allow glucose into all the cells. A little bit is coming in, but not enough. This is called insulin resistance. Okay. The other scenario is that there is insulin as well, but not enough insulin to allow the glucose to enter from the blood into the cells. Just not enough keys. Not enough insulin being produced by the pancreas to keep up with the glucose that we eat. And when that happens, the blood glucose levels will go up every time we eat. It's not able to go back down and enter into the cells. Treatment can include insulin injections or medication. It can include changing our diet to reduce carbohydrates and extra calories. It can also include physical activity to burn off any extra calories. What are the risk factors for type 2? Unhealthy eating, mainly. Lack of exercise also. That can lead to being overweight. Family history is a smaller reason why for type 2. Remember, type 1, genetic, family history. Type 2, it's lifestyle-based. So their treatment actually starts with changing their diet and working out more. If they cannot control their blood glucose levels that way, then they'll have to take insulin medication or injections as well. It's important to note that pre-diabetics, let's go back to that definition. Pre-diabetics can reduce their blood glucose levels without medication just by losing weight and exercising alone. So, the definition of diabetes is 126 milligrams of blood glucose per deciliter. 126, memorize that. Normally we have fasting blood glucose levels of 70 to 100. So if it's more than that, say 126, that's diabetes or above. Prediabetes is in between, it's a warning, it's between 101 to 125. Okay, where were we? Gestational diabetes is the third type of diabetes, and that only happens in pregnancy, only happens in 5 to 10% of all pregnant women. It's because of hormonal changes during pregnancy. Remember, insulin is a hormone. So when it no longer works properly, blood glucose levels will rise, and it has to somehow enter into the cells for energy. So women who have gestational diabetes, they have a higher risk for developing it if they ever had it before, if they were obese before, if their BMI was above 30, if they have a family history of it, and their treatment is to control their blood glucose levels by changing their diet, exercising, and sometimes insulin injections. After they have their baby, their gestational diabetes also goes away. They return back to normal blood sugar levels and insulin. So these are the three types of diabetes. Type 1, genetic, diagnosed in childhood. Pancreas does not produce any insulin, only 10% of cases. Type 2 is lifestyle-based, happens over time, so it's diagnosed in adulthood. Sometimes nowadays because of obesity, childhood obesity in childhood. The body has insulin, pancreas is producing insulin, but it's not enough or it's not being used properly. This happens in 90% of all cases. Gestational diabetes could be genetic, could be lifestyle, only happens during pregnancy. The body's not using insulin properly, only happens in 5 to 10% of all pregnant women. Now, it's important to know hyperglycemia is high blood glucose. Hypoglycemia is low blood glucose. Here's the low. Here's the very high. We want something in the middle. We want insulin to work properly so it can regulate our blood glucose levels. Not too low, not too high. What's too high? 180 milligrams per deciliter or higher. Remember, what's diabetes? 126. Hyper is even higher, 180 or above. Those symptoms are feeling thirsty or hungry a lot, sudden weight loss, urinating a lot, feeling very, very tired or unwell. Hypoglycemia, remember, is less than normal. What's normal? 70 to 100, so less than 70. Those symptoms include being irritable, cranky, anxious and nervous, shaky, feeling very hungry or sweating. This happens usually, hypoglycemia happens usually because there's not enough glucose in the blood. Maybe we skipped a meal and worked out. Maybe someone with diabetes forgot to take their insulin medication, took too much insulin and maybe skipped a meal, right? So they won't have very high blood glucose levels because of that. It'll go down and they may start to have hypoglycemic symptoms. The treatment for someone who's diabetic is to quickly have some glucose, whether it's a sweet drink or glucose or candy, they have to do it. Uncontrolled diabetes can lead to many things, including damaged blood vessels. That can lead to heart attack, stroke, tooth decay, nerve damage and amputation, kidney damage and kidney failure, even vision loss. How do we prevent type 2 diabetes? We cannot prevent type 1, so we can do something about type 2 diabetes by lowering our weight so that we're not obese or overweight. We can have a better diet, less carbohydrates, especially simple carbohydrates, exercise more. We can manage our stress, eat more fiber to reduce our cholesterol, which also damages our blood vessels. High blood pressure, we have to reduce that, which also damages our blood vessels. So diabetes is closely related to CVD, cardiovascular disease. Yes, diabetics can have carbohydrates. They should be complex and eaten evenly throughout the day, not skipping meals. Should be part of a complete meal with fats and proteins and carbohydrates together. Artificial sweeteners do not increase our blood glucose levels, so they can be used by diabetics. In this picture, we notice that the top line here is for Tom, and Tom, if you notice, even before his meals, he has a higher blood glucose level than 126. So he is diabetic. Okay, Susie might be pre-diabetic because we see that even before her meal, it's a little bit above 100. So she's pre-diabetic. It goes up normally after eating a meal. Normally, we would have a blood glucose level fasting before meals between 70 and 100. Okay, it's interesting information for you here, and your diabetes homework has some interesting links for you to figure out some fun facts.